Your dog may be showing warning signs that something is wrong, and ignoring them could be dangerous. Many dog owners overlook certain behaviors, thinking they're harmless, but some signs can indicate stress, fear, aggression, or even medical issues. Today, we'll go over the most dangerous dog behaviors, what they mean, and how to stop them before they get worse. Watch until the end to see if your dog has shown any of these signs. And don't forget to like and subscribe for more dog tips and training advice. 17 dangerous dog behaviors and their meanings. We will explore 17 dangerous dog behaviors that will change your parenting life. Chapter 1. Aggressive and threatening behaviors. 1. Growling or snarling without reason. Dogs communicate through body language and vocalizations. Growling or snarling without an obvious cause can signal stress, fear, or territorial aggression. A dog might feel threatened by a specific person, another animal, or even an unfamiliar environment. Some dogs growl when they are in pain or experiencing discomfort. Dismissing these early warnings can lead to more serious aggression, including biting. Understanding the trigger and addressing it through training or behavioral intervention is crucial. 2. Unprovoked biting or nipping. Dogs may bite for different reasons, including fear, dominance, or lack of training. Puppies often nip during play, but if this behavior continues into adulthood, it can become a problem. Some dogs bite to establish control, while others react instinctively to stress or sudden movements. Even a minor bite should be taken seriously. If not corrected, it can develop into full-blown aggression. Training, socialization, and consistent discipline help prevent this from escalating. 3. Guarding food, toys, or space. Resource guarding happens when a dog becomes possessive over food, toys, or a particular spot in the home. This behavior may start as mild growling, but can quickly turn into snapping or biting if someone gets too close. Dogs with strong guarding tendencies may feel the need to protect their resources from humans or other pets. Teaching a dog to feel safe while eating or playing is important. Using positive reinforcement and gradual desensitization can help reduce this instinct. 4. Lunging at people or other animals. Lunging can be an aggressive response triggered by fear, frustration, or lack of socialization. A dog that lunges may be trying to assert dominance or react defensively to perceived threats. This behavior is dangerous, especially for large or strong breeds that can easily overpower a person. Training techniques like redirection, controlled exposure, and reinforcing calm behavior can help manage and correct lunging before it results in harm. 5. Stiff body language with a hard stare. A stiff posture, rigid muscles, and an intense stare are warning signs that a dog is preparing to react aggressively. Unlike growling or barking, which are audible signals, this form of communication is silent, but just as serious. A dog in this state may feel cornered or challenged and could bite with little further warning. Recognizing these cues early and responding with de-escalation techniques, such as avoiding direct eye contact and giving the dog space, can prevent a dangerous situation. Chapter 2. Anxiety and stress-related behaviors. 6. Excessive panting or drooling without heat or exercise. Panting and drooling are normal when a dog is hot or after exercise, but if these behaviors occur without an obvious reason, they could signal distress. Excessive panting can be a response to extreme stress, fear, or anxiety. It may also indicate pain from an injury or illness, such as heat stroke, poisoning, or heart problems. Drooling without food present can be a sign of nausea, dental issues, or neurological conditions. If your dog exhibits these symptoms persistently, it's important to monitor them closely and consult a veterinarian to rule out serious health concerns. 7. Pacing or restlessness. A dog that paces back and forth or appears unable to settle down may be experiencing anxiety, frustration, or discomfort. This behavior is often seen in dogs with separation anxiety or those exposed to stressful environments. Restlessness can also be a sign of pain, digestive issues, or cognitive decline in older dogs. If your dog continues to pace without an apparent cause, assessing their surroundings and overall health can help determine whether the behavior is stress-related or due to an underlying medical issue. 8. Sudden hiding or avoidance. If a normally social dog suddenly begins to hide under furniture, avoid eye contact, or retreat from people and other pets, something may be wrong. This behavior often indicates fear, discomfort, or illness. Dogs may hide when they feel threatened, experience pain, or suffer from an undiagnosed medical condition. Stressful events like loud noises, unfamiliar visitors, or changes in routine can also cause avoidance. Observing when and where your dog hides can provide clues to the cause, helping you address the issue before it worsens. 9. Compulsive tail chasing or licking. Repetitive behaviors like tail chasing, excessive licking, or chewing on paws may indicate anxiety, boredom, or an underlying medical condition. Some dogs develop compulsive habits as a way to self-soothe when stressed, while others may have skin allergies, infections, or joint pain causing discomfort. In rare cases, compulsive tail chasing can be linked to neurological disorders. If your dog engages in these behaviors frequently or to the point of self-injury, seeking veterinary advice can help identify and treat the root cause. Chapter 3. Destructive or dangerous actions. 10. Chewing furniture, walls, or doors. Dogs explore the world with their mouths, but destructive chewing often signals an underlying problem. Stress, boredom, or separation anxiety can cause a dog to chew excessively. When left alone for long periods, a dog may chew as a way to relieve frustration or soothe anxiety. Puppies chew during teething, but adult dogs that destroy furniture, walls, or doors may be acting out due to pent-up energy or distress. This behavior can lead to broken teeth, digestive issues, or household damage. Providing chew toys, regular exercise, and mental stimulation can help curb destructive chewing. 11. Excessive barking at night or when left alone. Barking is a natural way for dogs to communicate, but constant barking at night or when alone often indicates anxiety, loneliness, or protective instincts. Some dogs bark due to boredom, while others react to external noises or perceived threats. If barking occurs only when the dog is alone, separation anxiety may be the cause. Identifying the trigger is key to stopping excessive barking. Providing comfort, training, or calming aids can help reduce anxiety-driven barking, ensuring a quieter and more relaxed environment. 12. Jumping on strangers aggressively. Dogs may jump out of excitement, dominance, or to assert control over a situation. While a small dog jumping may seem harmless, a large or strong dog can easily knock someone down, causing injury. Some dogs jump because they weren't trained to greet people calmly, while others do it as a territorial response. Teaching a dog to sit before greeting people, using commands like off or sit, and reinforcing calm behavior can prevent dangerous situations. Training and consistency are essential to managing this behavior. 13. Chasing cars, bikes, or joggers. Chasing moving objects is an instinct for many dogs, especially those with a high prey drive. While it may seem like playful behavior, it poses a serious risk. A dog that chases cars, bikes, or joggers can endanger itself and others. This behavior can result from a lack of exercise, herding instincts, or poor impulse control. Teaching commands like leave it and ensuring the dog is on a secure leash during walks can help prevent dangerous chases. Proper training and controlled exercise help redirect this natural instinct safely. Chapter 4. Sudden behavioral changes. 14. A friendly dog suddenly becoming aggressive. A dog that has always been friendly but suddenly shows aggression may be experiencing pain, illness, or emotional distress. Dogs can't express discomfort the way humans do, so they may lash out when something is wrong. Common causes include injuries, arthritis, infections, or neurological conditions. Emotional triggers like stress, fear, or changes in the household can also lead to aggression. If your dog growls, snaps, or bites without previous signs of aggression, a veterinary checkup is essential to rule out medical issues before addressing behavioral concerns through training or desensitization. 15. Loss of interest in food, walks, or play. Dogs are typically excited about meals, walks, and playtime. If your dog suddenly loses interest in these activities, it could be a sign of physical illness, stress, or depression. Medical conditions such as infections, digestive problems, or dental pain may make eating uncomfortable. Emotional stress from changes in routine, a new environment, or the loss of a companion can also cause a lack of enthusiasm. Monitoring for other symptoms, ensuring a comfortable environment, and consulting a vet if the behavior continues can help identify and resolve the issue. 16. Unusual lethargy or excessive sleeping. While dogs sleep a lot, a significant increase in sleep time or a lack of energy during waking hours could signal an underlying health problem. Causes of lethargy include infections, heart disease, anemia, or metabolic disorders like diabetes. If your dog seems unusually weak, uninterested in movement, or slow to respond, it's important to assess their overall health. A vet visit can help determine if the issue is medical, emotional, or age-related, allowing for appropriate treatment or lifestyle adjustments. 17. Frequent accidents in the house, even in trained dogs. A house-trained dog suddenly having accidents indoors may be dealing with anxiety, medical issues, or a change in routine. Urinary tract infections, kidney problems, or gastrointestinal disorders can cause loss of control. Stress from a new environment, separation anxiety, or disruptions in daily patterns can also lead to accidents. If the behavior persists, observing your dog's bathroom habits and seeking veterinary advice can help identify whether the cause is medical or behavioral, allowing for proper treatment or retraining if needed. Chapter 5. What to do if you notice these behaviors. If your dog is showing any of these signs, taking the right steps early can prevent problems from getting worse. 1. Observe the pattern. Pay attention to when and where the behavior happens. Does your dog react aggressively around strangers, only at night, or after a specific event? Identifying patterns helps determine possible triggers and find solutions. 2. Check for health issues. Sudden behavioral changes can be a sign of pain, illness, or discomfort. If your dog seems unusually aggressive, anxious, or withdrawn, a vet visit is essential to rule out medical problems. 3. Provide proper training and socialization. Many behavioral issues come from a lack of training or socialization. Introducing your dog to different people, animals, and environments from an early age helps build confidence and reduce fear-based reactions. 4. Use positive reinforcement. Instead of punishing bad behavior, reward good behavior with treats, praise, or playtime. This approach helps your dog understand what is expected in a way that builds trust and confidence. 5. Seek professional help. If the behavior continues or becomes dangerous, consulting a professional dog trainer or behaviorist can provide expert guidance. They can assess the situation and create a training plan tailored to your dog's needs. Some dog behaviors may seem small at first, but they can become serious if ignored. Recognizing these signs early can prevent dangerous situations and strengthen your bond with your dog. Have you noticed any of these behaviors in your dog? Let me know in the comments. And don't forget to like and subscribe for more dog tips and training advice.